I'm Julie Schallhorn from University of California, San Francisco.
Great. Can you just give us your thoughts on how difficult it is to see early corneal dystrophy?
Early corneal dystrophies can be pretty difficult to pick up. You see a young patient in your clinic, maybe they've worn contact lenses for a long time, they've got a little something in the anterior stroma, and you think to yourself, what is this? Is it, did they get something in their contact lens? They have an old ulcer. A lot of young patients that we see will say, yeah, I had an infection a few years ago, my optometrist gave me antibiotics, it's fine. And so you think, is that a scar? Is it a dystrophy? It can be really, really difficult to detect, especially in young patients without a lot of other findings.
And what's the implication of missing a corneal dystrophy diagnosis in a refractive patient?
Especially with the TGF-beta eye dystrophies, you get a dramatic exacerbation of the dystrophy after refractive surgery, especially after LASIK, and you have that potential space between the flap and the stroma that is just the perfect place for the dystrophic protein to accumulate. So you can take somebody with a very, very mild dystrophy, very early manifestations, maybe it would never be visually significant in their entire life, and dramatically accelerate to the point where they need corneal surgery and potentially corneal transplantation, which of course is extremely, carries a lot of visual morbidity.
Can you just talk about what the lessons are from those cases?
So I think the lessons are that you need to do a very, very careful, thorough preoperative exam and history. Ask for family members if they have anything, any history of corneal transplantation, any history of any family members having anything funny with their corneas. A lot of patients are not sophisticated, will not be able to give you a history that, oh yes, my mother has granular dystrophy. So you need to ask for subtle clues. And I think, especially from my cases, you need to know, and I think we all know from our clinical practice, that these dystrophies don't just occur in Koreans, where the majority of them have been described. They occur with some frequency in other groups as well around the world. So be on the lookout for those subtle findings in any patient that you see, because if you don't, you're really doing your patients a disservice.